Hi dear colleagues, I'm Dr.Sam Zeraatian Nejad Davani, attending Professor of Cardiovascular Surgery of Iran University of Medical Sciences and Healthcare Services, as well as Dean of Faculty of Heart and Lung Transplantation. Through this video with my colleague, Mr. Abulfazl Gholami, I'm going to speak for you a little bit about chronic thromboembolic pulmonary hypertension. As a matter of fact, there exists different causes for chronic thromboembolic pulmonary hypertension, but the most important cause is repeated deep venous thrombosis as well as pulmonary thromboembolism, which can cause pulmonary hypertension, and it can divide it into 4 grades. For grade 1, 2, and 3, there exists surgical treatment, but for grade 4, just medical treatment, including endothelin receptor antagonists, just like busulfan and etc. As you can see within the video, we had a patient with chronic thromboembolic pulmonary hypertension confirmed by transthoracic transesophageal echocardiography, as well as right side heart catheterization or CAT and CT angiography. Median sternotomy and bicaval cannulation performed for the patient after administration of heparin. And after doing so, an aortic cannulation, we cool down the patient up to 18 degrees centigrade, and defibrillator was ready in order to impede fibrillating heart during, cooling state. But at something about 22 degrees centigrade, cross clamp of the aorta and administration of cardioplegia from aortic roots performed. Bilateral exposure of pulmonary trunk, and as you can see, between the ascending aorta and superior vena cava performed. I call my technique to do that Zeraatian technique. I use special type of ecartors or retractors in order to expose right pulmonary artery. As you can see, you can make it available in your operating theater very easily. It is harmless and it doesn't damage or endanger any adjacent tissue or organs while you are performing endarterectomy. While opening the main pulmonary artery as well as right pulmonary artery, you have to find a true plane in order to dissect with Jamesonian as well as simultaneous suctioning of clot and overlying materials. After doing so, you have to be sure about completeness with angioscope of your endarterectomy, then closing the right as well as main pulmonary artery stitches. I remain some stitches open when weaning from cardiopulmonary bypass during rewarming in order to do RV training protocol for the patient. In RV training protocol, you impede volume and pressure after load on right ventricle during weaning off from cardiopulmonary bypass in order to impede RV damage, which is already moderately damaged previously as a result of chronic thromboembolic pulmonary hypertension status. Patient went from cardiopulmonary bypass uneventfully, rewarmed up to 35 degrees centigrade and transferred to ICU, and went from mechanical ventilation 3 days after operation.